Now, under Medicare Part B, this is medical. So what I want you to think of under Part B, these are all the services that are rendered by the physicians, the PA, the nurses, and up with inside of the actual facility, whether it be an outpatient, doctor's office, or hospital. So think of durable medical equipment. Think of oxygen, prosthetics, x-rays, MRIs, EKGs, PET scans. Those are some examples that are going to fall underneath Medicare Part B. Think of doctors, whether it be a primary care doctor or a specialist, and again, those services. So if you went to, let's say, for example, a physical therapist, those services that are being rendered with inside of the PT office or the occupational therapy, that's going to fall underneath Medicare Part B. Medications. Medications are only administered during a hospital stay, a doctor's office visit. So if you receive an injection of some kind, or maybe it was an antibiotic through a syringe, or an IV during a hospital stay or emergency room visit, urgent care visit, that's all going to fall under Medicare Part B. Now, Part B has its own deductible. And this deductible is $283, and this is per year, not a benefit period. Again, per year. So if this deductible is met in January or February, you no longer have any other deductibles. Now, Part B does have an 80/20 co-insurance. So after you meet your deductibles, you are responsible for 20% for Part B services. One variable, or what I would message I want to make clear, is that there is no cap in co-insurance charges. So if you have an individual plan, if you're self-employed, or you have a program through your employer, your spouse's employer, those plans have what's called a max out of pocket. So they can only charge you so much within inside a calendar year, that's a combination of your deductible and the co-insurance. Once you reach that max out of pocket threshold ceiling, everything's covered 100%. With Medicare, you're responsible for 20% no matter the cost. Now, when you go on Medicare Part B, there is a cost directly associated with it. That cost is a direct reflection of what you show in income. Being that we're in 2026, that income is going to be a reflection of what you showed in income in 2024. Now, we're going to provide you another video. It's going to give you some direct contacts into different variables and circumstances that may, if you retired or you're planning to retire, and how that can be justified. But if you are actively retired, it is going to be a direct correlation to what your income was in 2024. And so there's 6 different levels to what that dollar amount is. The base amount is $202.90. And that's per month. Now, again, that baseline is a direct reflection of your income. So if in 2024, if your income was $219,000 adjusted gross income, and again, that adjusted gross means that all your deductions, so you've netted below the $219,000, then your baseline for a joint married couple is $202.90. If you're single, your adjusted gross income is $109, and then it would be a $202.90 on a per monthly basis. Now, the premium deduction out of your Social Security check, that would change if you're not collecting a check. So for those that are deferring their Social Security check down the road, the future, then what they would do is they would bill you quarterly for that dollar amount. And then we'll have another video that we'll show you that shows what those different levels are in terms of income. Now, when you go on Medicare, Medicare goes into effect the first day of the month that you turn 65. That's if your birthday falls on the 2nd or thereafter. If your birthday falls on the 1st of the month, then it would be the previous month. So for example, if your birthday fell on June 1st, your Parts A and Part B would begin May 1st. Thank you for watching this video. Please share with friends or family, And we look forward to talking to you next time. Thank you.